Hi, my name is Jennifer Spencer. I'm with Brown & Brown of Southwest Florida. We are the benefits broker for Healthcare Network of Southwest Florida, and today we're going to talk about the difference between a health savings account and a flexible spending account. What is an HSA? An HSA is a health savings account. Note the middle word, savings account. You can have an HSA if you are enrolled in a high deductible health plan. The HSA is owned by the individual, and anyone can make contributions to the HSA bank account. There are three advantages to an HSA. You contribute on a pre-tax basis, the funds in the account grow tax-free, and you can withdraw the funds and spend them on eligible expenses tax-free. This is an excellent way to save for future healthcare expenses. The funds roll over year after year after year. This is not a plan, this is a bank account. So if you fund it for 5 years, all that money is going to stay there until you're ready to spend it. You own the account, you control the account. If you leave the company, it is still your bank account. You can continue to spend the funds or let the funds sit there and grow interest. The high deductible health plan, which you must have in order to have an HSA, has traditionally lower premiums than a copay plan. Here are the premiums for the two healthcare network plans. The copay plan is on the left. You can see the per pay rate for an individual is $88.10. Annually, that's $2,200. The high deductible health plan is just $25 per pay period, or annually it's $650. So you can see that an individual can save in premiums alone $1,641. At a minimum, if you enroll in the high deductible health plan, you should put the premium savings into the HSA. So for anyone currently enrolled in the copay plan, you're currently paying $88.10. Continue to have payroll take that much out of your paycheck. $25 will go to pay for the insurance, and the remaining balance will go to fund your HSA. The money in your HSA can be spent on your medical, dental, and vision expenses. So again, an HSA can only be offered in conjunction with a high deductible health plan, and there are rules to what is considered a high deductible health plan. At a minimum, the deductible must be $1,350 for an individual, $2,700 for a family, and a family would be anyone that covers one or more dependents. That is the current deductible for Healthcare Network's high deductible health plan. When the plan renews in May, the deductible will increase to $1,400 for an individual and $2,800 for a family. Now, the maximum out-of-pocket on a high deductible health plan cannot exceed $6,750 for an individual and $13,500 for a family. The out-of-pocket maximum for Healthcare Network is significantly less than that. It is $5,000 for an individual, and it is $5,000 for a family. So here we have the deductible and out-of-pocket maximum for the two plans at Healthcare Network. For an individual, the deductible is $1,000 on the copay plan, and the out-of-pocket maximum is $3,500. The high deductible health plan has a $1,350 deductible and a $5,000 maximum for an individual. Whether you cover dependents or not, no one on the copay plan is liable for more than the $1,000 individual deductible. However, on the high deductible health plan, if you cover one or more dependents, you must satisfy the $2,700 family deductible before the plan will pay any claims. Now you can see that if your family had a rough year, you could end up paying more in deductible and more in out-of-pocket maximums on the copay plan, because there is a per person deductible and a per person maximum, and it is capped for a family of 3 or more. So here we are taking a look at the premiums and the out-of-pocket maximum per plan, per level of coverage. If one individual in your family had, let's say, a 4-day stay in the hospital, you're going to meet your out-of-pocket maximum with that stay. So when we combine the premiums with your out-of-pocket maximum, you can see the savings with the high deductible health plan. But let's take a look at what it would cost if more than one person in the family had a rough year. In this example, we are looking at 2 individuals in the family that have met their out-of-pocket maximum. And again, the copay plan has a $7,000 family out-of-pocket maximum, where the high deductible health plan only has a $5,000 family out-of-pocket maximum. So you can see the significant savings if your family had 2 people ring the bell. So how does the high deductible health plan and HSA work? You can contribute to your HSA through payroll. It's like a direct deposit. You can increase, decrease, start and stop your contributions throughout the year. So if you start out doing just the difference in the premiums, $65 per pay, and then you want to increase it to $150 or $300, or you want to stop your contributions for a while, you just need to let payroll know. The money in your HSA can be used to pay for your high deductible, your coinsurance, any copays after the deductible. You can use your HSA funds to pay for dental and vision expenses. If you go outside of the network and you are being balance billed, or maybe there's a service not covered by the plan, you are allowed to use the HSA funds so long as they are qualified expenses. With the high deductible health plan, after the deductible has been satisfied, the plan will pay 80% of the remaining covered charges while you're still liable for 20%. So in the beginning, when you are having to pay in full for your office visits and prescriptions, your x-rays, your imaging services, that can be quite a hefty bill. But once you meet the deductible, you're only liable for 20% of those services. And you're going to in-network providers, hopefully. So you're going to providers who have agreed to accept discounted fees, and those discounts are typically in the 60% range. So you might have to pay $400 for an office visit while you're meeting the deductible, but once you meet the deductible, you're only liable for 20% of the office visit, and that can become like an $80 expense. So who is eligible for a health savings account? Anyone covered by a high deductible health plan and not enrolled in any other health insurance. That includes Medicare Part A, that includes a flexible spending account, whether it's yours or your spouse's. When you turn 65 and are enrolled in Medicare Part A, you are ineligible from funding your HSA any further. However, if you want to continue funding your HSA, you can contact Social Security and opt out of the Medicare Part A enrollment. You will be able to get Medicare Part A back when you're ready to retire and come off of the group medical plan. There will be a special 8-month enrollment window. But you need to keep in mind that when Medicare takes effect, it will go back up to 6 months from when you sign up. So if you're going to fund the HSA, you need to make a note to stop funding the HSA 6 months before you plan to enroll in Medicare Part A. A general purpose flexible spending account is considered other health insurance. The flexible spending account offered at Healthcare Network is a general purpose flexible spending account, so you cannot be enrolled in the FSA and open and fund an HSA. If your spouse works for an employer that offers a general purpose flexible spending account, you are ineligible from opening and funding an HSA. You would need to let your spouse know not to enroll in the FSA so that you can contribute to your HSA. If you're planning to make a switch at open enrollment in May from the copay plan to a high deductible health plan, and you're currently participating in the flexible spending account, you need to wait until the plan year is over and your account balance is 0. Now, some of you may realize that there is a 2.5-month extension included in the flexible spending account. So when the plan year ends on April 30th, if you still have $100 in the FSA, you have all of May, all of June, and the first 2 weeks of July to incur additional expenses. Once July 15th rolls around, any money left in the flexible spending account is forfeited, and at that point you could establish your HSA effective August 1st. So you want to try and spend the FSA money before April 30th, or you will delay your ability to open and fund the HSA until August 1st. The Allstate Benefits Supplemental Health Options Policy, also known as SHOP, or the hospital policy, is considered other health insurance, so you cannot have that policy and open and fund an HSA. Your contribution limits change every year on January 1st. The 2019 limits were $3,500 for an individual and $7,000 for a family. The 2020 limits, which came into play on January 1st, are $3,550 for an individual and $7,100 for a family. Again, a family is you and any number of dependents. So however you're enrolled in the high deductible health plan dictates how much you're allowed to contribute to your HSA that year. If you have only yourself covered, then you are subject to the individual limits. If you cover a spouse, a child, children, or the entire family, then you can contribute up to the family limit. If you join the high deductible health plan in the middle of the year, let's say May 1st, open enrollment, the IRS allows you to fund the HSA up to the calendar year maximum. However, you must stay eligible to fund the HSA throughout the entire following calendar year. So if you enroll in the high deductible health plan and open an HSA on May 1st, you can fund it $3,550 if you cover just yourself in 2020. However, the IRS wants you to stay enrolled in the high deductible health plan throughout the 2021 calendar year. If you're not sure what you're going to be doing a year from now, then you might want to prorate your contributions. So the individual limit is $3,550 this year, divided by 12 months. That is $295.83 per month. If you're going to be enrolled in the high deductible health plan for 8 months of this calendar year, then you would take $295.83 times 8 months, and that would be what your prorated contribution limit is. And then we do the same math down below for the family limit. For those of you that are new to the high deductible health plan and may need to visualize how this would work, I have an example here of me funding my HSA $63.10 every pay period, every 2 weeks. That is the premium difference between the copay plan and the high deductible health plan for an individual. So the first few weeks go by and I have no claims, and then I incur a skin check with the dermatologist and I need to pay $71.05. I pay that out of my HSA with my HSA debit card, and then I go back to contributing to the HSA through payroll. A couple of months go by and I have a primary care physician office visit billed at $91.88. A couple of months go by and I have an urgent care visit. That's $110. So you can see on the left-hand side how much I've contributed year to date, and on the right-hand side how much I have left after using the HSA debit card to pay for 3 expenses. There is a catch-up contribution similar to retirement plan catch-up contributions. If you are age 55 and older, you can contribute up to $1,000 more than the limits we listed previously. So instead of $3,550, you can do $4,550. Instead of $7,100, you can do $8,100. Because you are that much closer to turning 65 and being enrolled in Medicare, once you are enrolled in Medicare, you are no longer allowed to contribute to the HSA, but that money is always yours to keep and spend. And you can spend HSA funds on Medicare Part B and Medicare Part D premiums. If you cover your spouse on the high deductible health plan and you are both over age 55, you can both contribute up to $1,000 more. However, your spouse will need to establish his or her own HSA. So together, your contribution limits cannot exceed $9,100. You have the $7,100 family limit, the catch-up provision for you, and the catch-up provision for your spouse. And you can split that up however you like, but in order to take advantage of that extra $1,000 for your spouse would need to establish his or her own HSA. And regardless of the month in which you turn 55, you can contribute the full $1,000 as long as you were enrolled in the high deductible health plan all year. So if you were enrolled in the high deductible health plan for the last 2 years and you turn 55 on December 1st, you get to contribute the full $1,000. But if you're just joining the high deductible health plan in May and you turn 55 in December, you can only contribute the prorated amount for the 8 months that you were enrolled in the high deductible health plan. The next year, you get to do the full $1,000, unless you hop out early at the next open enrollment, and then again you would want to prorate it. So prorating is recommended if you're not sure what you're going to do the next year. Distribution rules. When you spend the funds in the HSA, as long as they are spent on qualified medical expenses, you are spending the funds tax-free. You can only spend the funds for services incurred on or after the date the HSA was established. So number one, you have to have a high deductible health plan in order to have an HSA. And number two, you have to have the HSA in order to pay for an expense. If you pay for an eligible expense with your regular bank money, you can reimburse yourself after the fact when there are enough funds in your HSA. Now let's look at a couple of examples. If you enroll in the high deductible health plan on May 1st and you establish your HSA on June 1st, when you incur a claim on May 10th, you are not allowed to reimburse yourself for that expense because you had the plan but not the bank account. In our next example, you enroll in the plan May 1st, you establish your HSA June 1st, you incur a claim on August 10th. Maybe you only have $75 in the HSA and the bill is $300, so you put it on a credit card. A few months later, if you wanted to reimburse yourself for that $300 expense, you can do that because you had both the plan and the account when the claim took place. There's no time limit on reimbursing yourself out of the HSA so long as you had both the plan and the account when the claim took place. HSA funds can be spent on you, your spouse, and your dependent children, even if you don't cover them on the high deductible health plan. Now, if you cover only yourself, you are limited to the individual contribution, but you are allowed to spend those funds on your legal spouse and your dependents. It is legal spouse, not domestic partner, and it is your tax qualified dependent, which could be your child or another qualifying relative. So you want to check out the IRS website to determine if maybe a mom or dad that is living with you is a tax qualified dependent. You cannot cover mom or dad on your high deductible health plan, but if you have funds in the HSA and want to spend them on a qualified dependent, you can do that. When you are over age 65, you can take the money in the HSA out and spend it on anything you want without facing the 20% penalty. However, you will always be subject to paying the back taxes. The money in your HSA should be earmarked for health care, medical, dental, vision, and some insurance premiums like long-term care, COBRA, and Medicare. But if you wanted to celebrate your retirement and take $5,000 out of the HSA and go on a wonderful vacation with your spouse, you can do that. The 20% penalty goes away, but you still have to pay the back taxes. If you accidentally use your HSA debit card during the year and you're not age 65, You have until the tax filing date of that year to fix mistakes, and your bank might have a certain form for you to put back money that was accidentally taken out. That could be due to you paying for a service that you actually ended up not owing. So you might get a reimbursement check in the mail from a physician or a facility, and you want to put that back into the HSA. There's a certain form so that it does not appear to be another contribution, because if you're funding it to the limit, you will exceed the contribution limit and be subject to penalties. So just contact your bank if you need to fix any mistakes. So what is a qualified medical expense? You can go to the IRS website to see a list of qualified expenses. It is expenses that primarily treat or prevent a physical or mental defect or illness. Here is an example of some qualified medical expenses: deductible, copay, coinsurance, physician office visits, inpatient or outpatient hospital services, prescriptions, dental, vision, and some insurance premiums. What is not considered a qualified medical expense? Other insurance premiums like your child's individual health insurance, over-the-counter medicines without a prescription, cosmetic procedures, and then tissues, toiletries, hand sanitizer. You'll be surprised to know that there are a lot of things that are HSA eligible, and if they're HSA eligible, they're also FSA eligible. And that would include contact lens solution, Band-Aids, bandages, first aid kits, sunscreen with an SPF of 30 or more. So we have a couple of references, some websites that you can go to obtain a list of qualified medical expenses. Always keep your receipts when you make purchases with your HSA debit card, if you make purchases online, if you get a statement in the mail from a provider or from the insurance company, be it medical, dental, vision for you, your spouse, your children, a prescription receipt from the pharmacy. Put everything into a file with the calendar year of the expense purchase, and then just file it away. If you were ever asked to produce records of how you spent your money, you can hand over the files. When you're doing your taxes, there are a few questions that are asked. You'll get a statement from your bank. You will also get information on the W-2 as far as how much you contributed through payroll. You will be asked, did you have an HSA? How much did you contribute? How much did you spend? Was it spent on eligible expenses? And that is pretty much the extent of the questions on the tax return. So here we have the side-by-side comparison of the HSA and the FSA. So the HSA savings account is something you can establish if you are enrolled in a qualified high-deductible health plan and have no other health insurance. Pretty much anyone can have the FSA. Now here at Healthcare Network, if you enroll in the high-deductible health plan, you are not eligible to enroll in the general purpose flexible spending account. So you would want to establish an HSA if you want to take advantage of saving for future healthcare expenses. The beauty of the HSA is that you own the account. You can go out to any bank and establish your HSA. We do recommend Suncoast Credit Union or First Florida Integrity Bank. Those are a couple of local banks that do not have fees for opening the account or maintaining the account. A lot of other banks will take $3.50 out of your account anytime your balance is less than $1,000. So Suncoast Credit Union or First Florida Integrity Bank. But just ask your bank for a list of their HSA fee schedules if you're considering another bank. The FSA is a plan administered by your employer. Qualified expenses when it comes to medical, dental, and vision are identical with the HSA and FSA, but only HSA funds can be spent on some insurance premiums like long-term care, COBRA, and Medicare. Your contribution limits run calendar year with the HSA, and they are much higher than the flexible spending account. The flexible spending account resets on May 1st. You are currently limited to $2,700. And whenever you make an election to participate in the flexible spending account, you are locked into that decision for the entire plan year. The HSA is a bank account. You can increase, decrease, start, and stop your contributions. And because it's a bank account, you only have access to the funds actually in the account when you go to swipe the card. So you do need to make sure that you don't swipe your HSA debit card for a $300 expense when you only have $75 in the bank account. With the flexible spending account, you get an upfront interest-free loan. If you pledge to put $2,000 aside, your debit card has $2,000 on it. And if you go to swipe the debit card in June for an $1,800 expense, it will go through. For the rest of the year, you will pay back that money through payroll deduction. HSA doesn't work that way. Whatever you contribute is how much you have access to. So there's no upfront loan with the HSA. But the HSA funds will roll over year over year over year. With the flexible spending account, it is a spending account, so you put the money in the account with the intent of spending it by the end of the plan year. If you have $50 or $100 on April 30th when the plan year ends, you do have that 2.5-month extension that allows you to go out and incur additional expenses and spend that money down. But once July 15th rolls around, any money left in the flexible spending account is forfeited. You will lose it. The FSA and HSA funds can be spent on you, your spouse, and your children, whether you cover them or not. Here are a couple of references for you. The IRS website, if you type in the search box publication 969, that is a great explanation of how HSAs work. There are great examples of what you can and can't do with an HSA. On that same website, if you search publication 502, that is a detailed list of qualified medical expenses for both the HSA and FSA, and that's where you can also confirm who is an eligible dependent, your legal spouse and your tax qualified dependents. If you visit hsastore.com or fsastore.com, you'll find a list of items that can be purchased with those funds. Things like contact lens solution, Band-Aids, bandages, first aid kits. I hope the information presented today was helpful. I hope that as we approach open enrollment and you're considering possibly switching plans or establishing one account versus the other, that the presentation today helped make it a little bit more clear as far as what you should consider. If you have any questions, I am Jennifer Spencer. Tim Kochi is the benefits consultant that is dedicated to Healthcare Network of Southwest Florida. We are both available to answer your questions, so give us a call or send us an email. Thank you.